What's up? I am here at Clinicals and I gotta switch out my badges, so that's what I'm doing right now. I left my house this morning and I completely forgot about my badge because I had took everything out of my backpack, but I had to go back and get it. Thankfully I was only like 5 minutes away from my house, so I was able to go back and I'm here on time, but I got like 3 minutes to get to the department and that may not happen because I don't think I remember where the department is here, but let's go. Hey guys, so it is my first day in the Nicu and I have about 7 babies and we did a bubble CPAP, so I was able to remove the nasal mask and then put the nasal prongs. I was able to section the mouth and the nose, and I was able to put the little beanie back on, not the beanie, put the little clip back on right here, and the preceptor did show me how to chart, and I did watch an extubation, and that was awesome, and I did see them transfer the baby from the BDR to the Drager, so the baby's on the Drager now. Yeah, I'm learning a lot. Hey, what's up? So I am on my way home from Clinicals. I think I had a pretty good day. I learned a lot. I seen the VDR in action. I have never seen any babies or anything on VDR, so today was the first time that I actually got to see that. And then I seen one baby getting switched over to Drager, which is really sad because apparently the baby is brain dead, and the only thing that is keeping that baby alive is the Drager. The Drager is breathing for the baby. And I guess there was a discussion going on that the nurse wanted the RT to put the baby back on the VDR, but the RT told the nurse no, go up on your dopamine on the baby, and then tell the family that there's nothing more we can do. We're going up on, we're on the max dopamine and baby's brain dead. There's not much that they can do at that point. But so the nurse and the RT are going back and forth. They don't agree, and the nurse doesn't really understand, I guess, that the VDR is not really going to help much because the baby has low blood pressure, and the RT was like, me putting the baby on the VDR is not going to improve the blood pressure because the baby has no lung problems at all. And so the baby is like a 30 weeker. I would have got more information on the history of the mother and stuff. I didn't get to do any hands-on charting, but the RT did show me the charting, and it is through Epic, so it is different. I haven't worked with Epic before. I've done Cerner before, so yeah, Epic is a little different, and of course it's different charting with babies versus ICU, and NICU versus ICU. You're charting cares, I guess, care assessments. And something I learned that was new today was that you switch out double nasal CPAP mask to
to nasal prongs Q6. So that's something I found out new today. And I got to do it all by myself, which was awesome. And the RT said I did an amazing job. And he said that he was really, really scared when he started. And it took him like 4 months to get comfortable and not be scared anymore. But I told him, yeah, the NICU is definitely where my heart is and where I want to be when I graduate. They hire new grads in the NICU. So I'm really excited about that. So, yeah. Hopefully I get this rotation again next semester. But I'll be here for 5 weeks. So it's pretty awesome. The RTs are so nice. The nurses are so nice. But of course, there's always got to be that one. So I guess there is one nurse that gives a lot of people problems. But the RT that I had today, he knows how to work around it. And he knows how to, you know, I guess make friends and be nice and cordial and stuff. And so the nurse was nice to him. And she was nice to me. She talked to me and gave me suggestions. And she said, like, your RT is not going to let you do anything if you don't know your stuff. If you don't know what you're doing, what you're talking about, and if you're not reading and researching, your RT is not going to let you do much. So I was like, okay, you know, like, I can do that. I was like, yeah, I was like, I have no problem researching and learning about things. And he asked me a ton of questions. Like, this is the RT that asked me more questions than any RT preceptor that I've ever had. And he asked me, okay, what is CPAP? What is PPD? You know, and I had to explain it to him that it's continuous positive airway pressure, and, you know, it helps keep the lungs open and oxygenate and everything. So he was like, yeah. He's like, yeah. Every answer I gave him, he was like, yeah, you got it. He was like, that's very good. And he's like, a lot of these students come in here and they don't know anything. And he's like, I'm glad. He's like, who's your teacher? Who taught you all this? And like, they're doing a good job. And I was like, yeah, like, some students don't want to read, but all they have to do is read the PowerPoints, and they'll learn a lot from the PowerPoints. And then if they go read the book, they're going to learn even more. And he was like, yep. He's like, you got to do your research. You never stop learning. And he's like, I like to teach my students that I get, because one day I might work with them. He said, actually, the students teach me new things also. And I was like, oh, that's pretty cool. And he's like, yeah, and you actually reminded me of something, and you actually taught me of something. And I was like, oh, I didn't even know. So that was pretty cool that I got along well with my RT preceptor, and everyone's really nice. I met the lead RT preceptor. She's really nice. I met other nurses, and we work hand in hand with the nurses while we're doing care. They're doing care as well, and it's really cool. And I know that now that I'm getting experience in the NICU, I'm finding out that, yeah, this is what I really want to do. So it does make me really happy to know that I am enjoying it, and it's awesome, and I do like it. So we were talking a little bit about the financial aspects of it, the salary, and I heard 2 RTs talking about how another facility is paying like $38 an hour, and how a lot of facilities are hiring right now. And we started talking about traveling and everything. So yeah, it was pretty cool. But yeah, I will see you guys tomorrow.
Hey guys, it's Tuesday, April 4th, 6:30 a.m. and I'm currently waiting for the RT lead to get here to let me know who I'm going to be with today. And I'm just going to get my lashes on, and I'll see you guys later. 8, maybe 8:45, and I'm not allowed to have my watch or my ring, so I don't have it on right now. But we did first rounds, so I was only able to listen to the lungs the first round, but on second rounds, the RT did say that she will let me do more of the cares, so I am excited about that. And I got to witness IPV and how it's given, how it's set up, and I also got to witness how the VDR is set up and how to manipulate the pressures and all of that. And I got to see an eye light on a brain dead baby with the pupils were not dilating, so that's a sign of that the baby is brain dead. So I saw that. And there's also a baby with staph, so a staph skin infection, so I seen that. And I will talk to you guys later. Hey guys, so it's almost 2 p.m. and we're about to go on our lunch break. I do leave at 3:30. I was able to do 3 cares, so that was pretty exciting. I'll let you guys know a little bit more later. Bye. So guys, I just got out of clinical and it's Tuesday. I'm gonna put my ring and my watch back on, but it's 3:38 and I'm gonna be heading home soon. There is people in the in this parking lot, so I'm gonna have to go talk to you guys somewhere else. Okay guys, I can talk now. So I was talking really softly in the bathroom because sometimes when I get out of the bathroom there's like people right there talking, and so I just don't want them listening to me. But anyways, today was a really good day. I got to do a lot of cares, which is basically you suction out the mouth, you wipe the mouth, so you do oral care, and then you suction out the nose. You use this little, I don't know if you call it a saline wipe, and you hold one nostril and then you suction the other, and you do it to the other side, and then you exchange the nasal CPAP to the nasal prongs. So we did that. That's Q6. And then we take off the little beanie, we massage the head, and then we take off the, I guess it's the strap that's holding the nasal CPAP down. We take that off and we just massage the cheeks and massage around the face, make sure that there's no skin breakdown, make sure there's no skin breakdown on the head. And after that, we go ahead and put the beanie back on, and then we put the straps back on. After that, we just make sure to write down all the vital signs, write down what the baby is on. So say he's on bubble CPAP, how many centimeters. So the baby was on 6 centimeters of pressure and 6 flow and 21% FiO2, and we were actually weaning him, but he was initially on 23% FiO2, so we wanted to go ahead and start weaning him down. His x-rays looked really good. The RT showed me his x-rays and he did really good on the x-rays. He was a little hyperinflated, the perforation. They don't know if it was from the intubation because he got intubated 6 times, and so he was a very hard intubation. So he got intubated 6 times, and the OG a little too far down into past the stomach, so they think
that maybe it went into the intestine because it was way too far down. Gladly, there's no bleeding or anything like that. His lungs looks like pretty aerated. The heart looks good. It was aerated up to the 8th or 9th rib. There was no flat diaphragm, so that was good. So we did have another baby that has a PDA, a PFO open, 1.4 PFO, and I think a 1.6 PDA, something like that. And so that baby's also on bubble CPAP. So I also got to do a care on that baby. I got to witness IPV today for the first time, but I didn't get to try it. One I did the other day was more like a aerogen nebulizer. This one was an actual IPV. So I got to see how she did it. And we haven't done that in our labs, and we haven't really learned too much about it. So I thought it was pretty interesting. My RT preceptor was amazing today. The one from yesterday was amazing also, but I feel like I did less care with him. And today with this one, I feel like I did a lot more cares. I think I did 4 to 5 cares today, and yesterday I did like 2 cares, and I did 2 aerogen treatments, 2 cares. I might have done 4 cares yesterday. I don't know. I need to document better, and I need to write down more like of what I'm doing, because right after I do it, I need to write it down just so I know what I'm doing, and so I know how to keep up and remember what I did. Yeah, it's pretty awesome being in the NICU. So let's see. I had 4 babies today. One of them was a 23-weeker. I'm not too sure about what was wrong with that baby. And then, well, I think it's a 26 or 27-weeker. That's the one with the PDA and the PFO and intracranial hemorrhaging. It's not too bad, so there's nothing really that they need to do right now. But if it gets worse, then they will do surgery. And then if the PFOs don't close, then they will do surgery. But right now they're not looking at surgery. They're waiting to see if it'll heal and close on its own. The mom did come in to hold the baby. So that baby got skin to skin with the mom. So that was awesome. I got to see how the nurse and the RT kind of set the baby up and the mom up and moved around the wiring and everything, and positioned the baby on the mom and everything. So that was pretty cool. I got to see that twice. There is one baby where the mom, she is in a rehab. She actually turned herself into a rehab, a drug rehab place. So I think that's pretty cool that she turned herself in and that she's trying to get help. So her baby is pretty much a drug baby. He's on bubble CPAP, but or she's on, I don't know. She's on bubble CPAP. She's doing good. That's the one that they're trying to wean. So actually, that one's probably doing better than the other 3 because they're actually trying to wean that one. The other ones, they're still not being weaned at the moment. I think they are trying to they are trying to wean 2 of the babies. They have them down to 21% FiO2. One is at 5 CPAP. I mean 5 centimeters H2O. The other one's at 6 centimeters H2O. So the one that they're weaning is actually they're weaning him down on to from 6 to 5, and then from 23 to 21%. And then the other 2, the one on 6 centimeters, 6 liters flow, and 21%. That one is actually on a non-invasive VDR. So I got to see the VDR on non-invasive mode, and I thought that was pretty cool. There really isn't a mode on it, but the doctor ordered it for non-invasive, so you can actually use it with the nasal mask CPAP machine, not machine, but the nasal CPAP. You can actually use that VDR with that, which I just learned that's something new I learned today, because I thought the VDR was only for intubated patients, but it's not. You can use it for intubated, or you can use it for CPAP. So it's pretty cool, and it's a percussive mode, so it's an oscillator, and it keeps the alveoli from collapsing. It does not let them close. So I learned a couple things today, and my RT preceptor was pretty awesome. I got there at 6:30 this morning, and I'm leaving at 3:37 p.m., but I'm supposed to leave at 3:30. So when I got there at 6:30, they were doing rounds, so they were getting report. They weren't doing rounds, I'm sorry. So they're getting report, that's what it's called. I know when I was a CNA, we would call it getting rounds, but it's called getting report. So they were getting report, so I got to listen a little bit, but I kind of blinked out after a moment because I was lost and I didn't know what they were talking about. And they were naming all of the labs and the CBCs and the hematocrits and all of that. So I do need to brush up on that and actually research more and get more familiar with all my lab numbers. So that is very, 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 very important when you go to the NICU. You need to know your CBCs, your WBCs, ABGs. So you of course need to know your ABGs and your baby ABGs, baby CBGs and BBGs. Need to know those. Well, you should know about the glucose, and you should know about your heart diseases, heart defects. Definitely should know about your heart defects in the neonates. They just stopped a diesel over here. I'm going 60 miles per hour, so I'm not going too fast. 6:30, they were giving report. We only had 4 babies, so they gave report on all 4 babies. And then we started doing her first rounds at 7:38-ish. She did her blood gas through the heel stick, and the blood gas came out better, so that was awesome, but it was still low, 720 and pH and 56 CO2 and 27 bicarb. I think it was 20 bicarb. I guess the bicarb was a little acidotic or something like that. So anyways, it was more metabolic than respiratory issue. So they think it might have to do something with the heart or something else. But anyways, that's the baby with it was high hematocrits. And that might be because of the intracranial hemorrhaging. But anyways, what else? They were trying to figure out if the baby needed bicarb. And they were trying to figure out if the blood glucose was affecting the pH or the bicarb or something like that. So today, I mean, I shouldn't be excited about this, but I got to see what a brain dead eyes look like, because the nurse said, "Come here, Andrea, you want to see, have you seen the baby's pupils yet?" And I said no, and he said, "Okay, you want to see?" And I was like, "Yeah." So he took out his pen light and he said, "Okay, go ahead and shine the light on the eyes." And I'm like, "How do you use this pen?" He's like, "Oh, you just press it right here." So I pressed it, and I had the light shining on the eyes, and he's like, "Do you see the pupil?" And I was like, "Let me get a little closer." He's like, "Yeah, you need to get a little bit closer." So I got a little bit closer, and he's like, "Do you see the pupil?" And the eye was completely black. Like, you could not see the white part at all. The eye was completely black. And I was like looking, and I was like, "The pupil's pretty big." And he goes, "Yeah." And he goes, "Do you see any dilation?" And I said, "No." And he said, "Yep." He said, "That means," he said, "there's no dilation, so that's a sign." And I was like, "What is that a sign of?" And he goes, "That's a sign of being brain dead. And I was like, wow. And I was like, is the family aware of this? And he's like, yep, the parents are aware, but they're waiting for God to do a miracle. And I was just like, okay, like, I understand. And so basically they're saying that the baby's pretty much a vegetable, and he's just on the ventilator. The ventilator is what's keeping him alive. And I asked, like, how long could the baby last on the ventilator? And they said it could be 6 years, it could be a year. They really don't know. But one of the RTs was saying that they might as well just trach the baby, keep the baby on the ventilator, if that's what the family wants. But yeah, it's just kind of like the parents have to accept, and they really don't want to accept, and they don't want to let the baby go. So we'll see what happens. I think that's all I learned today. I'll have to look back on my notes and kind of share from there anything else I learned that was new. But yeah, so this is week 11 for you guys, and I got 4 more weeks left. So catch you guys later. Talk a little bit about today. So 2 mommies came in and they were holding their babies, which is awesome. One of the mommies hadn't came in to hold the baby for 2 or 3 weeks. No, 3 weeks. So that's a very long time, and it's just like so sad, because if that was my baby, I would want to be there to hold the baby. But I know that the reasoning was that the family members smoke in the house, so she didn't want to expose the baby to that secondhand smoke. So I understand, be even third-hand smoke, so it's understandable. But I'm so glad that she did come today and she was holding her baby. That was very, very awesome. Yeah, I had a really good week this week in the NICU, and tomorrow we have NRP, hand skills, and then we have 2 quizzes and 1 exam on Thursday. So I do gotta study for that. But thank you guys so much for watching. Don't forget to like, comment, subscribe, and see you guys in my next video. Bye.